lead. It destroys lives.
In 1984, 3 to 4 million preschoolers in America had blood lead levels high enough to affect intellectual and behavioral development. There is no known safe level of lead in the blood. Lead can affect almost all organ systems. The primary focus of the effects can be seen in the central and peripheral nervous systems, the cardiovascular, gastrointestinal, renal, endocrine, immune, and hematologic systems. Lead is a cumulative, toxic, heavy metal that accumulates in the body, including the bones.
It doesn't have to happen. You can prevent exposure.
What are the general steps taken to test for lead contamination on the base in order to protect employees from exposure?
There's two primary sources of lead at the Coast Guard Yard. The first would be in buildings at the yard, because most of the buildings were built back in the 30s and 40s when lead-based paint was the primary paint used. And the second would be on the ships themselves. There's lead-based paint used on most of the ships. And what's done is we test both the ships and the buildings before any work is done on them for the presence of lead-based paint, and then take the appropriate precautions to work with the lead or remove the lead prior to working on that project. The most common routes of exposure or pathways to transmit lead from the workplace to a home would be on the persons themselves or on their clothing. So as long as good hygiene is practiced and people clean up before they leave the workplace, clean their hands, wash their face, etc., and then wear coveralls or protective clothing over their clothes, or change their clothes before they go home, they leave the lead here at the workplace and don't take it home to contaminate their families.
Test your home. Use the lead testing sticks or hire a contractor to come out and do a lead inspection. If you discover you have lead in your home, hire a safe and respectable contractor to tear out the paint and dispose of it properly.
In order to prevent your children from being exposed to lead paint, it is important to check any toy that they could potentially come in contact with or place in their mouth. Some children's toys have been known to have lead paint on them.
Oral chelation therapy stimulates the urine excretion of lead out of the blood. The chelation compound binds to the lead and is then excreted through urine and fecal matter. It cannot help flush out the lead reserves in bone or when incorporated into body tissue. The excretion of lead could reverse some minor effects of lead poisoning, but the persistent chronic effects may never be reversed and did not improve cognitive function in the affected children.